you for joining the event. CüR Laser and MiraDry are coming together to educate you on a permanent reduction of underarm sweat, hair, and odor, all three in one. Okay, Alina, I'll let you kick it off with the introduction of Dr. Kumar, who's actually going to pop on in just a little bit.
Yeah, he's our founder and director. We've been doing MiraDry together for over 4 years now. So if you ever see me at West Broadway, I'll be alongside with him doing the treatments. And yeah, we performed over 163 sessions together here. But yeah, that's on he's our director. And then myself, I've been here the longest at West Broadway with Dr. Kumar for over 6 years now. But I'm the main one for MiraDry. I've had the treatment done myself as well when I first launched here. So I can definitely fill you in on my experience and how my results have prolonged and so on.
Okay. I'd like to start it. Oh, there are 2 locations for CüR Laser, West Broadway and Park Royal, the newest location. So 2 convenient locations for you. All right, I always like to start off with a video because it does a great job of showing the actual MiraDry. Can you all hear it? Hopefully you can. Because it really gives you a visualization of how the treatment actually works. I want to talk about excessive sweating, which also can be called hyperhidrosis if you have a diagnosis. Some people get diagnosed, some people don't. It affects over 365 million people globally, and 1 in 20 suffer from excessive sweating or hyperhidrosis, and 65% of those patients have issues in the underarms. And I'll just let you know that I've been with this company since 2017, and I remain with this company because I had extreme hyperhidrosis. I've tried all the medicine, Botox, pills, nothing really cut it. It was a temporary fix, and I'd always have extreme side effects like rashes or dry mouth. And then I had the MiraDry treatment twice, and I have not had any issues with sweat or odor since 2019. So it really has been a life changer for me. I don't have any issues with sweat or odor, which is absolutely amazing. So underarm sweat and odor is uncomfortable, and it can be embarrassing. And why stress over it if you don't have to? So you might be a MiraDry patient if you're bothered by underarm sweat and odor. If you're changing clothes frequently, who on here, obviously this is a rhetorical question, but who on here can't keep a white t-shirt without a yellow stain in it? I mean, that was me for sure. If you carry deodorant with you all day, or if you apply it more than 1 time per day, to mask underarm odor. And, I tried every deodorant on the market and it would work for a couple weeks. And then you have to switch to different brands because your body gets used to it. If you avoid social interactions, like wearing certain clothes, or if you have, you're afraid to hug or present because of your sweat stains. And if you're emotionally impacted by underarm sweat or odor, or if you're receiving or considering Botox for sweat, those are people, or if you just want to live a natural lifestyle, MiraDry is here to help. So let's talk about the different treatment options. Obviously, you can take oral medication, you can try deodorant. There is MiraDry. It uses thermal energy to permanently destroy the sweat and odor glands. Crazy thing about sweat and odor glands are that once you're born with them, they don't you don't regenerate. So you're born with a certain amount of sweat and odor glands. The other thing is that you only have 2% of your sweat glands in your underarms. So by destroying them, it does not affect your body in a negative way. The results are permanent. It addresses sweat, odor, and hair of all colors because it is not a laser. Most patients need 1 to 2 treatments, and there's little to no downtime. Botox, if you have Botox, it's every 6 to 9 months. You need to take off work, come in. It doesn't address odor and it doesn't address hair. And then there's also the last option is surgery. And there is downtime, 2 to 3 weeks. And it just works on sweat and odor reduction, no hair, but it can be a costly procedure. Okay, MiraDry is FDA cleared by using thermal energy to eliminate sweat and odor glands while reducing the hair in the underarms. And again, as I said, it doesn't pick up doesn't need to pick up pigment like lasers. So all color hair is addressed. So let's get into the science. There are 2 types of sweat glands, the eccrine gland and the apocrine gland. The eccrine gland produces an odorless clear fluid that helps the body control the temperature. So it's the sweat. In general, hyperhidrosis is often associated with this gland. The other type is the apocrine gland, and that's the gland that produces thick fluid. And when this fluid is in contact with bacteria on the skin surface, it causes the body odor. So that's why a lot of patients who have hyperhidrosis or excessive sweating also experience body odor. So this is just a visual of what the glands look like, the eccrine and the apocrine. And MiraDry is designed to treat 2 to 5 millimeters where the average patient's sweat and odor glands live by destroying them. I'm going to flip this over to Alina so she can kind of talk about the room setup and how her thoughts on the MiraDry procedure.
Yeah, so this is the device that we use to treat the patients. As you can see, the little handpiece on the side, that's what I use over the stencil area once we begin treating you. It is using heat energy, but like I said, you'll be fully numb before even starting the treatment. From my experience, I don't have to wear deodorant anymore. I've had the one treatment and I definitely had at least 70 to 80% reduction from my experience. Definitely like stress would cause some flare-ups or having to change my shirt throughout the day. So like having that one treatment, never have to wear deodorant, never have any like stress, anxiety that can flare it up even more excessively. But in regards to treating, so like once I take you into the room, I usually clean the area, I'll prep it, I'll mark it. I'll put some numb even before Dr. Kumar comes in just to make it more comfortable for you. Once he comes in, he'll inject the whole treatment area that we'll be covering, and then I will be putting a stencil on and then using the handpiece, and we're going to go point by point and run through the whole armpit area while it's treating. So this kind of shows you, we'll numb the area. It'll definitely look a little more puffier than this most likely, and then I'll put my little stencil on. And then point by point, we'll be eliminating the sweat glands and terminating their lifespan.
Okay, I'll talk about the clinical results. 93% of patients are no longer bothered at sweat by 1 month. So that is a huge percentage of patients. And this is after 450,000 treatments. 93% of patients are no longer bothered by sweat. 80% of patients are no longer bothered by odor. So obviously this is a very effective treatment. And as I said prior, you might need patients who walk through the door who have excessive sweating or who have a diagnosis of hyperhidrosis, most likely will need 2 treatments. If you're just wanting to live a natural lifestyle and avoid the deodorant smear on your black shirt or clothes, or if you're, you don't want the harmful chemicals, then you might just need 1 treatment. So I put this in here because I cover an account in Minneapolis, and this is one of the RNs that I worked with. And she sent me these pictures because this was after her 2nd treatment. And I use it because it's very telling. So after her 2nd treatment, this is before her 1st treatment, and this is after her 2nd treatment, after a long day of work. And she said she was she would never be able to wear gray, but she did it for this purpose, to kind of show the sweat. So prepping for the treatment, Alina, would you like to take this over, or would you like me to talk about the prep?
Sure. Yeah, so I usually give you a call reminder 4 to 5 days before. I'll get you to pre-shave the hair in the area if there is hair, or unless they've had laser, just don't touch it. Day of the procedure, same thing. I always just say, like, wear a tank top, or I do give you a garment to put on. So I just have like a clear space to treat the area. Once you're done, we'll send you home with some ice packs for the first few days, so you can use them to make sure the helps with inflammation. And then for aftercare, are we getting into aftercare after? Or?
Yeah. No, let me go. Yeah. So the aftercare instructions, yeah.
Yeah, so aftercare, I always say the first 2 days might be the most kind of annoying, where you just definitely want to ice it, take it easy, just rest at home. Keeping the area clean. So changing your shirt throughout the day, or just even once a day, would be a good thing if you're being active or just being out and about. I would say, so keep the area clean. No shaving for 2 weeks, just because we don't want to cause any cuts or infections or irritation in the area. And then not wearing anything super tight, just so we have a little bit more airflow for the area to heal faster. And then no shaving for 2 weeks, and no heavy lifting, no heavy exercise, nothing that will cause you to sweat, because we want the area to heal properly. So anything that you do to irritate it can trigger, side effects, which we don't want to get into. But if you do follow all these things, then you should not have any complications. And I always do check in with you daily, weekly, and then after your 2 weeks as well.
Yes. And so we have a couple of contraindications, which are very few and far between. Do you want to talk about that, or I can?
You can go over it.
Okay. So it's contraindicated for patients who have pacemakers or any other type of electrical implanted devices. It's also contraindicated for people who are on supplemental oxygen. And if you've had a history of intolerance of local anesthetic, and including lidocaine and epinephrine, typically if you've been to the dentist and had a procedure, you would know this. Some patients don't know, but my reference is always if you've been to the dentist, and you're able to, and then you're fine. Common side effects during the procedure, you may experience bruising and pain from the injection site, because you are getting the high volume anesthesia, so that it numbs and makes the procedure as comfortable as possible. You might get tiny little bruises or bruising from the injection site, because the video that I showed, you can see the skin is sucked up into, which it doesn't hurt, but it's sucked into the handpiece. So it's able to deliver energy. Every patient will experience swelling, pain, redness, and bruising, lumps and bumps, altered sensation. And how I explain this is that you'll be able to tell if I had the procedure today. Someone could look at me in a tank top and say, oh, her underarms are swollen for the next week. After that, you will notice that you have swelling to continue, but others won't notice. It just depends on how long it takes your body to dissipate the fluid that is injected for the numbing process. And discomfort and pain, it's treatable with medications such as ibuprofen.